Hello, everyone, and welcome to another episode of 2 Minute Emergency. I am your host, Dr. Leslie, board certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you these episodes to help educate you about steps and medical issues to help keep you safe, healthy, and out of the emergency department. So my topic for today is asthma exacerbation. Now, the reason I'm talking about this is because I am seeing a lot of cases of asthma exacerbation in the emergency department. There are a lot of contributing factors to this. One of the most common this time of year, of course, is the fact it's spring. So you have the pollens engaged, so many different pollens that people have problems with. Now you say, okay, but that sounds more like an allergy than asthma. Well, everyone who has asthma has some type of trigger, and pollens can be one of them. One of the other major triggers, of course, is tobacco, cigarette smoke, cigar smoke, pretty much any kind of smoke. Here in West Texas, one of the big things is the cedar. We have a horrible time with people who have asthma who have problems with cedar because it is so prevalent in West Texas. So when people have asthma, there's a couple things that happen. First of all, you're usually diagnosed at an earlier age. Asthma can start as you get older as well, but usually in the elderly, it is not you don't get a new diagnosis of asthma. It's usually related to some other underlying pulmonary issue like pulmonary hypertension. But for people who have been diagnosed with asthma, they have certain medications that they take. There are two main groups of medications. One are the preventative medications, and the other is the rescue medications. So when we think of preventative, we think more of anti-inflammatories for the lungs. That's the way to put it. So that can be inhaled corticosteroids. That's the most common. But there are other medications. There are leukotrienes. There's several other things that we use to help control people's asthma. Now, for acute episodes, the most common thing everybody thinks of is albuterol. And so that is considered a rescue inhaler. And that's one of the things that helps to dilate your bronchioles. I can't, tongue-tied at the moment. Help to open everything up a lot easier and quicker. So two different types of medicines. Now, one thing that I warn people about is there have been in the past, and I believe it's still on the market, is some over-the-counter medications for asthma. I personally do not trust them. And there's a reason I say that. Because what often happens is it opens everything up, but then they have a reactive phase where it's almost like an adverse reaction. Everything closes back up and can close back up very quickly. So it's a rebound effect. And that can put you in more trouble than if you hadn't taken anything at all. So if you have asthma, a couple things to watch out for. Number one, know what triggers your asthma attacks. If it's smoke, for goodness sake, please stop smoking. Stop being around people who smoke. And I know tobacco is addictive, but this is your life we're talking about. It's not worth a cigarette. So that's number one. If it's environmental, obviously, it's difficult to stay away from the environmental, but if you are well in tune with your medications, taking them like you should, and making sure if you're running low, contact your physician to get a refill, whether it's contacting them or if it's time for you to have an office visit so you can get refills, please do so. It is of the utmost importance because you can die by not having your medications. It's a preventable death. So please make sure you keep up with your medications. And there are other things that you can do at home. There's something called a flow meter. And the flow meter measures the ability for you to breathe in and out properly. So it tells you a little bit about the constriction, the bronchoconstriction that you may be having. So a flow meter is a simple device and it measures your exhalation. So if you can find one from your doctor, get one from your doctor. If you've been diagnosed with asthma, every asthmatic should have one of these at home. And make sure you measure the first time when you're feeling absolutely fine. That way you know what your baseline is. If you start to have difficulty, try using it. See if you've dropped from your baseline. That is the time when you need to seek medical attention. So, step 1, avoid the triggers. Step 2, make sure you keep up with your medications. And step 3 is if you think there is a problem and your medications are not working for you, please don't hesitate. Come to the emergency department so we can take care of you. I hope you found these helpful. Once again, I am Dr. Leslie, your board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you these tips on a regular basis to help keep you safe, healthy, and out of the emergency department. Until next time, take care and be safe.